So if you're getting some knee pain and the doctors are telling you that it's arthritis or that they just want to go down the injection route, or you're not really getting answers, they want to just do surgery. You've tried maybe physical therapy, but it's not really working, then this is going to be a talk for you, because we're going to go into a lot of different scenarios and a lot of different things that can mimic arthritis, that can mimic like a meniscal tear. And also talking about like where the side of the pain is often not where the source is coming from. There can be issues in the back and the hip that can create pain in the knee. You can have issues in the ankle that also can create, and there can be combinations of things. So we're going to talk about all those things. So big things we'll be getting into is why pain pills and medications, injections don't always work. We'll also get into surgeries and what some of the research says about surgeries as we get older, like cleaning out the knee, or even people in line for total knee replacement. We'll talk about some of the research there. Why MRIs lead us down the path to more procedures, and that they don't always give us like exactly kind of what's going on. They can be very misleading. And we're going to go into all the different sources of knee pain that get missed to help people get to having more of a full resolution. We're going to go into what healthcare providers miss and helping you get back to living a life and staying active and mobile. And then we're going to go into some things, the new things that we've purchased over the last couple of years that are going to give us some faster relief with knee pain using the Beamer and the shockwave. So we'll talk a little bit more about what those are and how they can help. So a little bit about me. I'm a physical therapist, and there's actually 4 of us at Empower, and we really work as a team to help give everyone the best results that we possibly can. All super experienced PTs. I went through my McKinsey diploma, which is just another degree that you can collect. That's just higher level critical thinking of understanding kind of like how the body works. I was a Division I athlete, so I was always interested in how my body worked. I definitely had a surgery in my knee that I wish I never would have had. If they would have listened to me, if the doctors would have listened to me, it would have been a very different situation, but they don't always listen, and they always think that they know what's best versus let's take all the information in for what the patient's describing and saying and come up with a game plan that way versus brushing them off, which is what happens. And it's very, very frustrating as a patient. I mean, I've been there. I've the age of 20, my doctors, I've had 2 knee surgeries before the age, like, gosh, I was a collegiate soccer player. So I had one in college and one just outside of college. And basically maybe when I was 25 years old, they said I had like 8 out of 10 arthritis in my right knee already. And I'm like, that's crazy. I'm in my 20s and I'm still active, and I'm in my 50s. So I just didn't believe them. And I have found ways for myself to help me feel my best. So I've been practicing physical therapy for 23 years, and I've had a lot of things that have happened with me from a health perspective that's made me super holistic and really believing that the body has an amazing ability to heal if we give it the right environment. Now, there are times I'm not against surgeries. I'm just against a lot of the surgeries because there's so many things that people can do to allow their body to heal that they don't even know. And we just do surgery after surgery after surgery in this country. And I think there's a lot of things that we can do to help our body heal. Really the aging expert and helping you feel your best. I mean, I'm getting older, and I don't want to slow down. I don't want to stop. So I'm finding things for myself that everyone else is benefiting for, because I'm super active still and I don't want to slow down. And I know that's how my patients are. And really we have the best team in Dallas for pain that no one else can solve. That's really what our sweet spot is. Because we have time and because we work as a team, and we all have unique capabilities that works well blended together. So, I always say where the side of the pain is often not where the source of the problem is located. And you're going to hear this over and over again. And we'll talk about that a little bit more. And then make sure you stay tuned to the end, because we do have a special offer at the end. So causes of knee pain. Let's get into some of this stuff. So you have decreased mobility, and this can happen in your hip. This can happen in your back. This can happen in your ankle, and this can happen in your knee. And this is when the joints aren't moving the way they're supposed to be moving. And why does this happen? So like, as we get older, we tend to not move as much or like all over the place. Like when I was a kid, I'm flinging myself, I'm moving side to side, I'm up and down, I'm all over the place. As an adult, I'm sitting, I'm standing, I'm walking, I'm running, I'm cycling, I'm hiking. I'm always in the same plane. And so we keep these joints in the same type of plane and positions, then it only moves in like one or two directions versus it being able to move in a lot of different directions. And when that happens, it can create pathways in the joints to kind of stiffen them up. And when you have a stiff joint, regardless if it's the back, the knee, the ankle, the hip, then your body's going to compensate and go around it. And when that happens, you do that long enough, all of a sudden you're like, I hurt one day. I don't understand what I did. And that's where you have to get to someone that can specialize in really sitting down and talking to you, because most of the time those are fixable. That just, you didn't go and fall and injure yourself. Like you literally were probably, doing something repetitively that we have to figure out what you're doing throughout your life that has created some of these things. And we start unwinding that and teaching you and giving you guidance around how we can fix that. So that's first thing. So our first thing that we're always looking for is mobility. How do the joints move? Because we have to fix that first in order to get the correct muscles to fire. Then we start looking at movement imbalances, movement habits, and even at that point, tightness in muscles that happen from either being overused because of the way you've been moving. We can start looking at those. If you have decreased mobility, those muscles will protect around that joint that's not moving. And if you release those muscles, they come right back again. And so that's why when you notice, if you get massages over and over and over again, you're like, why does it come back? I don't understand. It's because we have to fix the mobility piece first. And once we fix the mobility piece, then we can start working on tightness that happens around the joints or wherever we find it. I mean, we could find tightness in the hip that's creating knee issues. We can have tightness in the back that's creating knee issues. You can have tightness down below, close to the ankle that's creating knee issues. So we start looking at those muscle imbalances, what's weak, what's tight, what are your movement habits? So we get into some of those things so that we can start unwinding what you're doing and how we can combat that. So, I mean, we have things that we have to do throughout the day. Like most people have sitting jobs. Like you're not going to be able to stop sitting. But we start coming up with solutions on, okay, so let's maybe get a standing desk, or there's bedside tables that you can get to where you can stand and work part of the day and sit and work part of the day. There's things that we can do, or let's do these stretches, every 3 hours so that we can offset the sitting and the bending that we're doing. So there's things that you can do that can combat things that we have to do every day. And so then again, yeah, the muscle tightness, the hips, the IT band, hamstrings, quads. We have to get to the why on why they're tight. So if there's tightness and it just comes right back again, that gives us a clue that we missed something. Maybe everything's moving, but now it's, how are you recruiting this muscle? We've got to fix that pattern. Otherwise, it's just going to continue to get tight because that part of that muscle is overworking. Happens a lot on the lateral part of the hip, and it will produce pain in the lateral part of the knee. We'll get into a little bit of that a little bit later. And then just making sure that we clear up any back issues or hip issues as well, because they all can cause knee pain. So pain location, along with questioning, can give us information on where to look and where to start for a case. So if someone has decreased mobility in the knee, there's some common things that can happen with that. So a common source that mimics a meniscal tear is something that we call, there's fat pads in the front of the knee. And when we do a lot of things where we've been bending, or maybe we stepped off a curb and twisted, or we were kneeling, or whatever the case may be, there's things that can mimic this and it limits the motion. And a common thing that'll happen with something like this is you'll stand up and the knee wants to kind of give away. We also find people that are diagnosed with arthritis, it's the same thing that happens to them. And you can also get we get wear and tear. in our joints. We all do. It's like, it's part of aging. It's kind of like we get wrinkles on our face. It's a part of aging, but the wear and tear doesn't mean that that's where the pain's coming from. And sometimes you can get pieces that get stuck in the knee, and you can do mobilizations to flush it out. And then all of a sudden everything returns and it feels really good again. So that's one big area that can reduce knee range of motion. Another area that can happen is you can have issues within like your tib fib, and there's a bone that's just below the knee that is called your tibia, and it's on the outside part of the ankle. That's the outside part of the ankle bone that comes up along the side. And then that's the fibula. And then the tibula is on the inside ankle bone, and that comes up, and those get connected really close to the knee. That also can create issues with knee range of motion that needs to be addressed. Other things that can cause issues with knee range of motion is you can have a lot of tightness all around the top part of the knee. That is the most common area that becomes more degenerative as a tissue. And there's things that we can do with that, where we'll talk a little bit later on shockwave, where we can basically knock out some of the degenerative tissue, some of the scarring, some of the adhesions or calcifications that happen all around that knee, to where then all of a sudden you get that muscle to activate again when you couldn't do anything. It didn't matter what you did, you just felt it in your knee joint. And that makes it feel like, oh gosh, I have an arthritic knee. I know it's happened to me. I'll share my story a little bit later when we get into shockwave, but those are some things that can really reduce that knee mobility and are common sources. Pain on the inside of the knee. Outside of the knees. Next one, pain on the outside of the knees. So this comes from a lot of times when people, because that's what I ask, like, where do you feel it? And they'll point to it. And so they point to the outside. I start looking at, okay, what's going on with that IT band? The IT band crosses two joints. And if you have weakness in the hip, then a lot of times you're going to recruit the outside part of that hip, and that IT band is going to become that stability, and you'll feel it in the knee. Sometimes you can have it where it might not necessarily be the IT band, but you're recruiting a lot on the front part of that hip that attaches into that pelvis on the outside. That also will produce that lateral knee pain. Now, with these things, you have to look at, okay, why is it tight? Why are you recruiting that way? Is it purely a weakness thing where the hip extensors aren't firing, the adductors aren't firing, or is the hip joint not moving? And really common, what we find, because we're always sitting and we're always bending, the hip joint doesn't move as well going backwards into hip extension is what we call it, but moving that hip backwards. And so when that happens, then you can't get those muscles to fire and those hip extensors, because that's what it does. The hip extensors move that leg to the back. So you recruit everything to the outside. And so you have to get to the why of that. And there's several reasons why that happens. You can also have pain that gets referred from the back into that lateral hip that also can cause issues. So there's a lot of things that we have to look at when looking at the pain on the outside of the knee. But the common reason why that happens is usually IT band, poor recruitment of muscles. And then you have to look into why that happens. Pain on the inside of the knee. This happens when mostly because of poor recruitment of muscles. It could be that fat pad that I talked about, that can be a little bit more medial that's happening. And that can make you have some pain on the medial side. A lot of times it's adductors. It feels like it's a long pain along that joint line, and the adductors on that side are super tight. They all attach down below in the knee. And a lot of times I can poke on that spot, and they'll be like, oh yeah, that hurts. I'm like, okay, it probably hurts in that medial hamstring and those adductors on the inside of the knee. You start releasing those, and people are like, wow, I feel so much better. And then again, you have to get into why. A lot of times when we release that and just do some general exercises to strengthen the areas that we find that are weak, that goes away fairly quickly. That's one that goes away pretty quickly. Also, the decreased knee mobility, if it's coming from the fat pads, also can reduce pretty quickly. And that's, again, what I said, like mimics. We'll talk about some research on that mimics an arthritic knee where people are in line to have a total knee replacement. Pain that moves around the knee. When it moves around, it's like it's here and then it's over here and I can't really pinpoint it. Man, that's the first sign that I'm looking at the back, because that's really common for the back. And a lot of times you're poking around, it doesn't even hurt, but you feel it. Again, those are things that I look at when it's the back. So let's get into why medications, injections don't work. And so I like to get into like how we feel pain. Unfortunately, in our medical system, we just treat symptoms all over the place, which it drives me bananas. And there's a lot of questions that we can ask to determine what category we are in. And that's what we're going to kind of go through today, so that you'll be a little bit more educated on, gosh, is a medication going to help with my knee pain? Is an injection going to help with my knee pain? And you're going to know if it is or not, and not waste your time doing some of those things and getting to someone that actually can help. So we feel pain in three ways. We feel pain: mechanical pain, thermal pain, chemical pain. We're going to talk about this category first. So thermal pain would be like burns and sunburns. Well, let's take those off the list. That doesn't happen that often. I don't deal with like any kind of doing therapy for like the skin when there's burns or wounds, or doing like wound care type stuff. But we're going to get into mechanical pain and chemical pain. Those are the two most common categories. So let's go into chemical pain. Chemical pain is like when you have an injury and it just happened and the knee swells up and you get that throbbing, aching, constant pain. That is chemical pain. You're getting the chemicals in there. A lot of times that will eventually go away. Sometimes it doesn't. Sometimes we do need to take some drugs or get an injection to calm things down. But the pain should be constant pain. Chemical pain does not come and go. It's not like, well, it's there one day and then it's not there another day, or I do this and it makes my knee swell up. But then other days, if I don't do it, it doesn't make my knee swell up. That's not chemical pain. That's mechanical pain. And if you treat chemical pain like mechanical pain, that's why the drugs and injections don't work, because that's the first defense that doctors want to do is, oh, let's just give you an injection and see if it works. Well, you could go and ask questions like, can you change your position to make your pain better or worse? Does your pain come and go? Are there times when can you make your pain better? You know, if you ask them these questions and they're saying like, yes, I can do this and my pain will come on. That's mechanical pain. The chemical pain, like the drugs and injections, are not going to work for you. And it's a really easy question to do, but they just don't have time. Unfortunately, the doctors don't have time to dive into it. And the only thing they know how to do is to give you medications or take you to surgery. That's it. So those are the differences between chemical pain and mechanical pain. And oftentimes they're both together and you've got to address the mechanics. So I'm going to give you another scenario that can be common. So you can have someone that has a kidney infection, and this is just really easy to kind of see. So they have a kidney infection and you get that throbbing, aching pain. You can't change your position to make it better or worse. So they're going to give you some medications to reduce your pain, which is great. It does reduce the pain because it is chemical pain. But why is the chemical pain there? It's because there's an infection. So if you don't get to the infection that's causing the chemical pain, then you're just treating a symptom. And so this is where you have to get to the mechanics of understanding how the body works. Otherwise, you literally aren't going to solve your problem. You're going to be frustrated, which we see a lot of people that are frustrated. There's other pain pathways that we like to talk about. And the other two are autoimmune and emotional. These don't happen as often, but they do happen. And they're very different in the sense that if you have someone that has an autoimmune condition, they can't really pinpoint it. They can't change their position, make it better or worse. We can go and look at objective findings. We can't really find any, or we do and we get better, but they don't get better. Then I start asking them other questions like, okay, tell me a little bit more about like your gut health. Like, you know, are you always bloated? Are you fatigued? Are you, having problems sleeping? Are you noticing even eating healthy foods that you get bloated? Like I'll start asking these questions. They're like, yes, 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 yes. How did you know? I've been going to doctors for years. And I'm like, well, this case, like, this is it. Like when you have the mechanical pain, there's patterns to everything. You can see the patterns and kind of figure out the patterns. When you have autoimmune, there's no patterns. That's why doctors have no clue how to treat them. And honestly, you have to go and fix the gut health. So you got to get to someone that understands the gut health and doing blood work and figuring out like, what is it that you're missing, and using diet and some, supplements to help get things back into balance. And it's amazing when you do. And we have a doctor that we send people to, and it takes a little bit of time, but they get amazing results by working on their gut health, which is awesome because these people when I tell you they've been through the ringer, and when a lot of times these patients that have stuff like this, they are sent to psychologists because they're like, it's just in your brain. They are made to think that they're going crazy. I mean, we see stuff like this all the time. And then emotional pain is more like you've had some sort of trauma, and the trauma that you're having is presenting itself in a physical way. And we see this all the time. And I've had a very similar situation that was, it didn't hit me from a physical way in the sense of like orthopedic, but it did hit me in a hormonal way. And it was a total big emotional component that I had to get over when my dad died, and my body just kind of fell apart. And I had to like learn how to like let it go to get my body back into balance. And when I did, everything like went back into balance. But you'll see things like this with patients when you're noticing like all their objective measures in the office are doing better. You no longer can reproduce their pain in the office, but they still have the pain. And then we start asking questions like, well, when do you have the pain? Well, every time I go to work is when I start noticing it. I'm like, okay, what's going on at work? Well, it's very stressful. I'm like, you start diving into that and you're like, there you go. Like, you're going to have to change how you view that, because that is presenting a very physical pain in your body. Or they'll say things like, I don't understand. I went away for vacation. All my pain went away, because they're no longer at that place, at home where they feel the stress. They're away. So their body no longer presents it. And so I'm like, that is a classic emotional component. So there are things that we look at beyond just mechanical, just trying to get people and guide people to the right place. So what does the research tell us? And why does surgery lead us to more surgery? So I'm going to start with like the cleanup, which doctors love to do in the knee. And they did research where they cleaned up the knee. And typically, in my, like what I've seen in my, like of all the years that I've been doing PT, when you get about 40 and above, it's rarely a meniscal tear that causes your pain. It just isn't. Like it's not. It's usually other things that are happening that are causing your pain. But what happens is they do an MRI and it shows a meniscal tear, and they want to go in and clean up the knee because that's all they know how to do. So they did surgery where they went to go clean up the knee for people. And one group of people, they basically just poked the holes in their knees. And in the other group of people, they went and cleaned it out. And the group of people that they poked the holes in actually did far better than the people that actually had the surgery. The more you start messing with the knee, the more problems you're going to have. I mean, there was a knee surgery I wish I never would have had. And if the doctors would have listened to me, it would have been a completely different situation, but they didn't. And I did have a meniscal tear when I was playing soccer. So I was like, well, the first surgery worked, so the second surgery should work as well. It's exactly what the patients do. Like the first surgery worked when I was younger. So this is the same kind of surgery. So it should work again. And it doesn't always. And so you have to be careful, because there's a lot of things that, again, can mimic a meniscal tear. There's a lot of things that can help. That the meniscus usually is not the problem when you're older. They also did research with people in line for a total knee replacement. And what they did was, these were people that were waiting to have a total knee replacement, and they're given an evaluation by a McKinsey therapist, which is what we are at my office. And they went and put them into two different categories. They put them in categories where they did some knee mobilizations because they didn't have full range of motion in their knee, and they put them into a general exercise category. So if they had full range of motion, they just put them into general exercise. So of the people that were waiting for a total knee replacement, 40% of them resolved within like 3 or 4 weeks. 40% of the people waiting for a total knee replacement. That's insane. That's a huge number. And again, there's a lot of things that can mimic knee arthritis. And if people say they're bone on bone, like when we hear like grinding, yeah, you're probably going to need knee surgery. But a lot of times we don't hear knee grinding. There's a few patients that we have. I'm like, ooh, I just don't think we're going to be able to help. We can try, but you're getting a lot of, and it's a different kind of grinding. There's it feels like you're on bone. So there are cases where people are like that. And I do recommend, having a total hip replacement. And we've had a patient that had a massive knee injury a long time ago. And he's been our client for a long time, following us from place to place that we've, have been around for a while, but we've been at multiple places. But anyway, the doctors were impressed that he lasted as long as he did. I mean, he was in his 60s now, and he decided I'm going to go ahead and have it. And so he did, but his knee was like, this was construction back when he was in his 20s. And I'm like, what kind of surgery did they like? That's a huge scar. And they just had to reconstruct his knee because it was a really serious injury. Well, when you have a really serious injury, you're probably going to have a knee replacement at some point on that knee. But he literally probably had 40, 45 years of no problem cycling, pretty active guy that was a firefighter, not having too many problems. We were able to manage it. So, I'm not totally against knee surgeries. It does happen. But when I tell patients, it's probably going to need that, they're usually shocked on their face. They're like, well, if she said it, then I guess I really do need it because I say it so rare. I mean, we probably send 1 or 2 clients to surgery per year, 1 or 2 clients. That's it. And so that's how rare it is, but there are times when we have to. So again, we've helped thousands of clients reclaim their life back. These are all just different scenarios of different people that have had issues. So a lot of these people were told they need to have surgery and were able to avoid it coming in here. And a lot of people, we were like their last resort because they were so frustrated with not getting answers elsewhere. So why does MRIs lead us to more procedures? When you look at the research on MRIs, it is not great. And, when I was going through my McKinsey, the diploma program, one of the biggest things we had to do was read a lot of research. I mean, I had a stack really high of just reading research. And this is where I was really shocked because this is not something I learned in PT school. And I was kind of shocked that I didn't learn it in PT school when it's supposed to be, evidence-based. But it was research after research after research after research. And what it showed was if I took 100 people that had no pain whatsoever, 60 to 80% of them are going to show something, whether it's a rotator cuff tear, a meniscal tear, a labral tear, arthritic changes, herniated discs, degenerative changes. These are pain-free people. 60 to 80% of them showed something on their MRI and they're pain-free. So if you're having pain, is that something that's happening? Or is it really something else? Like you have to question it. So like we don't ride on MRIs as the end all be it all. Now we'll do our evaluation and kind of compare. It's like, nope, that doesn't make sense because like you're presenting this way. So we can basically from the MRI go like, nope, that's it doesn't look like that's where all your pain and everything is coming from. Now, the reason why this happens, so it's also why when you have people that are young and they get MRIs, they don't show anything. So I've had to treat my niece and she was like 19 at the time and she got all these MRIs and was having all this back pain. It was during COVID. I'm like, it's because they're freaking sitting around doing nothing, playing video games and on their computer because that's what they have to do for school. And that's why they're having all this back pain. Well, it showed nothing. I mean, it was so crazy what they were talking about doing a spinal tap on her. I'm like calling my brother going, could you please just get her in to see us? And sure enough, her back was so stiff when we did some mobilization, showed her some stretches. And she was like, oh, I feel so much better. I go, yeah, it's from sitting in front of the computer and playing video games, like you're not up and moving around because of COVID. Like it's crazy, but the MRI didn't show anything because she's so young. What happens as we get older is we get more wear and tear on things. So it's kind of like, as we get older, we get wrinkles on our face. It's just part of aging. Well, we get wrinkles on our bones and our musculoskeletal system. And so just because that happens doesn't mean that it's good or bad. And there's a lot of things that we're going to talk about on how we can help keep them feeling their best with some of the procedures that we do at our office. So what are other things that healthcare providers miss? So a big thing is lifestyle changes. What are you doing repeatedly that's creating your problems? Like these are things that we ask, like we want to know what you do repeatedly because we have to kind of combat that. And if we're noticing that, we're cycling all the time and we're sitting, well, we're keeping our back bent, our hip bent. This creates all sorts of problems. And so we've got to take these joints in the opposite direction to keep the fluid in there, like just to keep the joint moving. And so that's a big thing. It's kind of like if I pull my finger back and I hold it back day after day, year after year, and I don't ever stop holding my finger back, it doesn't matter what I do to that joint. It doesn't matter if I do injections, massage, strengthening, joint mobilizations. The problem is my finger is pulled back and the joint doesn't like being in those positions. So that's things that we have to address so that you get back to feeling your best. The other thing that people do is they only look at the side of the pain. They only look at their knee. I mean, we had someone that had an ACL surgery and they were going to another clinic, and it was just a lot of people in that clinic. And eventually she called the office, and she was like, I'm having so much knee pain, and they're dry needling my knee, and it hurts. It's not getting better. I'm like, come in. And so she came into the office, and we started assessing her. I'm like, well, her hip didn't move. And that was creating pain on the like outside of her hip, that was creating pain on the outside of her knee. And as soon as we got her hip moving and released some of the tightness after getting that hip to move, her knee pain went away that day. And they'd been dry needling and doing everything around the knee joint. I'm like, it wasn't a knee issue, it was a hip issue. So again, you can't just look at the side of the pain. They only look at the injury one way. So like you go to a massage therapist, they're only looking at your soft tissue. Like, wait a second, this is how everything works together. Like it can't just be one thing. Or you go to PTs and they only do strengthening. I'm like, no. We got to look at how the joint moves. We got to look at, the structures around the joint. Is there tightness around the joint that needs to be addressed? Okay, yes, we need to do strengthening, but it's a combination of all these things that we have to look at. And it's not just at the knee. We have to look at how the whole body works, because it's all connected. Or they only look at doing injections or stem cell or things like that. Again, you have to get to the why of what it is. You need to look at the whole body. Or they only look at imaging and base their whole decision off that. That's the doctors, because they only have 10 minutes with you. So they want to go and take a look at your knee. Oh, yes, this looks really bad. And yeah, this is what I suggest that we do, which is either drugs, injections, or let's go and do surgery. And that's what they have to offer. Or this is a great one. We hear this too. You're not bad enough yet, but when you get bad enough, come back and we'll do surgery. I'm like, what is that? Like, that's crazy. But people are being told that. So here's a success story. This is a guy that actually was from a patient. So the wife had been coming into our office, and she was begging him to come to see us. And he went into the doctor. They did an MRI, and they said, you have a meniscal tear. He was scheduled for knee surgery and everything, and just really didn't want to do it. So he decided, okay, well, I'll give them a try. And this was literally like one of those things that, where we just did some knee mobilizations and showed him how to do it. And he was like, cancel the surgery. I feel so much better. And I'm like, yep. Like, it's rare. Like, they were just going to go in and clean up his knee. I'm like, no, please don't. No, please don't. Those don't work. Like, can we please see you? But that's, again, a case that they had surgery scheduled, and we were able to take them off the surgery. And luckily he listened to his wife. So other things that we have that work really well is, it's called regenerative therapy. They call it shockwave. And what this is, it's something that helps with like muscle and tendon injuries or degeneration. Big time degeneration happens around that knee joint. And when that happens, circling the top part of that knee joint, it doesn't matter what you do. You could go massage that all you want. I've done it. Like, I've had it and in my knee, where I was like, golly, this is not working. And I can't, like, I'm doing exercises. I'm trying to do functional exercises. And all I do is I feel it in my knee joint, and I'm trying to not, I'm, making the exercises easier. Nope. I feel it in my knee joint. Like, I can do everything on the table, but I couldn't do anything where I put my feet on the ground. And I literally was so excited when I got shockwave last year. I'm like, I'm the first person I'm gonna try it on, because I want to see what it does. And yeah, it, like, I could feel all the tightness, and it referred pain in all the different spots that I could feel my pain in, which was crazy. I wasn't doing shockwave there, but it was referring where I was feeling my pain. And I kid you not, I mean, after the second visit, I was like, holy cow, I actually can like lunge and not hurt. I can now strengthen my muscles and get stronger around the knee joint to protect my knee, to make my knee feel better. And it did. Like, I think probably 6 treatments on myself. And it was the beginning of where I was been able to like actually strengthen my knee. And now my knee feels better than it has in probably 5 years. And it was from the shockwave, from helping me do that. It also can help with nerve healing. Success with some like MS patients, because you get adhesions along the spinal cord. We basically want to see what your, imaging looks like, so that we can figure out kind of where those adhesions are. And we basically do shockwave to kind of knock those out. Diabetic neuropathies, it doesn't take away the numbness, but typically what people feel that bothers them most is the pain and the swelling. And that's what it can knock out. It doesn't knock out the numbness, but it definitely knocks out the pain and the swelling. Scarring, C-sections, man, C-sections can create scarring that can give you some bowel obstructions. This can take a lot of that scarring away. It goes pretty deep. And it's pretty amazing. I might have some pictures of that on this, but I don't know if I do, or I can't remember. And then it speeds up healing. So like we had someone that had like a calf strain, and it literally sped up the healing by like 50%. I mean, massive calf strain. A volleyball player landed on it, eccentric loaded it. It was purple. It was torn. She was a firefighter. And we literally was like, let's do shockwave. So we did shockwave on it. And after the second shockwave, she was able to fight a fire going up and down stairs with all of her stuff. There's no way that would have happened without shockwave. You just don't heal that fast from something massive like that. That usually takes you like 4 to 6 weeks to get to that point. And we did it in 2 weeks. So pretty amazing. Chronic injuries like arthritis, where the tissue stuck around the joints. Talked about that. Improving muscle activation. So you'll definitely get some improvement in that muscle activation pretty quickly. So here's a guy that had a massive rotator cuff tear, and we're going to talk a little bit about like what shockwave did for him. Couldn't even raise his arm up at all. It's pretty amazing. And I think it was like 6 visits, and he's like, fully functional. And now he's working on strength training and doing really well.
Mountain biking and crashed and hurt my shoulder and couldn't use it at all. I mean, I was a Tyrannosaurus Rex. This is all I couldn't raise my arm like I can now. It was like on the pain scale, it was a 10. And so I came home from mountain biking and went to see my sports medicine doctor. And he said, they gave me an MRI, X-ray, nothing broken, but the MRI showed that it was 80% torn. And I can't remember the specific muscle that runs along the top here, but supraspinatus or something.
Yeah, supraspinatus.
Correct. Anyway, so he gave me 3 options. He goes, I can do nothing and just use a remote control to watch TV, but that wasn't good enough for me. He said I could go to physical therapy, or I could have rotator cuff surgery. And I was like, well, I'm going to go to do physical therapy. And so I showed up here and started doing therapy, and I couldn't do much. I mean, they gave me the evaluation, and I had no strength and no mobility. And
yeah, you couldn't even get your arm really off your body at all.
Right. I could do that, maybe this, but I couldn't get my elbow away from the side of my body.
Yes, because exactly. That's how bad it was.
So I decided to go to a shoulder specialist as well. And I brought him the results of the MRI, and he looked at that. He didn't do any evaluation or anything. He just said, when do you want to do the surgery? And I'm like, whoa. I'm going to do physical therapy for a little while and see how that goes. So I started the physical therapy, did a couple of weeks, and then I was seeing some improvement. But then the shockwave treatment started, and I did the first one. And the first one was a little uncomfortable from a percussion standpoint.
Yeah.
The device is kind of like, I guess I don't know the names of the tools or recovery.
I call it a jackhammer.
Right, a jackhammer, a jigsaw or something like that on the shoulder. And it wasn't real uncomfortable. On the pain scale, it was manageable.
Yeah.
Probably a 4 or 5.
Yeah.
But I think I did 4 or 5 treatments, and every week I got better and better and better to where now, I mean, I don't have full strength, but it's probably 70 to 80%, but there's no need for surgery.
Yeah.
And everybody that tells me about rotator cuff surgery is that there's like anywhere from 4 months to 12 months to where I wouldn't even be able to do this.
Yes. It's horrific. You can't sleep for like 2 or 3 months. You're like in a recliner because you can't even lie back flat because it hurts so bad.
So here's some other examples of shockwave. This was the firefighter that I talked to you about. Literally, like it was, I don't think it was 1 visit. I think it was 2 visits, but she literally sent us a message and a picture going, oh my God, I actually could do this. Cause that was her biggest fear, was like, she couldn't do her job and that she was going to really hurt herself at her job. So we did shockwave, and it did a great job. This was a C-section scarring. So the C-sections take a lot longer. Scarring like this takes a lot longer, but you can see the progress of the scarring And it's quite amazing. Now, let's talk a little bit about the Beamer, which is it's a type of pulse electromagnetic field. We just got this probably a couple months ago. Again, I'm always looking for things that help me feel my best. But you know, as we age, we have injuries, disease. We lead more sedentary lifestyle. And what happens is the cells in our capillaries tend to stick together, creating problems with blood flow. And that's a problem because the capillary system is literally like it's everywhere. It affects every part of our body, literally. And when we don't have good blood flow there, that's where you get the nutrition exchange, the oxygen exchange. That's where you get the deep, like the removing the waste. All of this happens at that cellular, at that like capillary level. And if you don't have that, that's a problem. And you'll have more inflammation in the body. You'll have more pain in certain areas. And so what the Beamer does is it helps increase oxygen and nutrition and waste removal by up to 30%, which is pretty amazing. And, you know, in healthy, active individuals, what happens is we should have 3 to 5 times micro movements per minute in a capillary system. That's a healthy, active individual, 3 to 5 times of micro movements per minute. But an unhealthy and aging individual, you may have 3 to 5 micro movements in 7 to 10 minutes. And that's a problem because that's where you are going to be more sore from like exercise or working out, because you can't get rid of, you know, when we have micro traumas in our muscles when we exercise. And so if you don't have good blood flow and oxygen to those areas, it can't repair itself very quickly. But you also have the lactic acid that you have to remove. Well, you don't have the way of removing it because things aren't moving very well. And so when all this improves, you'll notice those things improving. Your inflammation, swelling in joints, will go down. You'll notice that your recovery will be so much faster. You'll notice that your sleep gets better because you're able to detox your body better. And so when we look at the circulatory system, it hits every single system in our body. And if we can improve this is going to give you a whole body system like boost. And so here's an example of a male that's under stress. And this is what happens after 3 to 6 minutes of using the Beamer. And then what happens 30 minutes after using the Beamer. So they're going to talk a little bit more about that.
How does it work? Folks, Beamer stimulates muscles. The pulse electromagnetic field from Beamer moves through the area being treated, stimulates the tissues and the cells that the pulse electromagnetic field interacts with. The effect extends through the tissue into the vessels, as you can see on the screen here, supporting healthy local circulation where the field is applied. In addition, Beamer inductively stimulates your muscles in order to increase blood flow and optimize muscle performance as well as supporting recovery. I want to take a look here at this intravital microscopy video. This is the local microcirculation of a male who's been under chronic stress. And what we're seeing here is a zoomed in view of a local area of microcirculatory vessels. And on the left side of the screen, you're looking at an arteriole that's vertically orientated, and on the right, also oriented vertically, is a venule. The small vessel that is branched off horizontally on the left is a capillary. Arterioles are responsible for bringing oxygen-rich blood into the capillaries, which then deliver the blood and its components to the cells, which are vital for these cells to function. You can see the blood flowing clearly in all the vessels here observed, but the little capillary is not being adequately perfused with blood. Therefore, the cells do not get what they need to work properly. You're going to see here also that there's no vascular movements or oscillations occurring with the arteriole on the left side, which should be. In addition, there's restricted blood flow, there's poor perfusion, and diminished venous return. Too much of this going on, and you're going to feel tired, you're going to feel sluggish, maybe even experiencing cold hands, cold feet. But one thing's for sure, poor blood flow can be the precursor to many issues that people experience every day, and they don't even know it. Let's take a look here at what happens to the Beamer after it was only turned on for 3 minutes of treatment. You'll already start to see this increase in blood flow. You can see the capillary open up. There's an increased arterial flow. And what you can also see is this increased venular flow, returning carbon dioxide back to the lungs and clearing out the waste products from our body. Here we are after 6 minutes of Beamer use. I want you to pay special attention to the right side, this venule, where the white blood cells are rolling over the endothelial walls of the vascular lumen. Think of it. It's like the cops or the police being out on the streets patrolling and protecting you. That's your mobile immune system. When your blood is flowing, when it's moving, your immune system is more vital. If your blood is not functionally flowing, you can't possibly have a high-functioning immune system. Therefore, you're not protected. You can think about it this way. If you're perfused, you're protected. Now we're going to take a look at, and we're going to see the lingering effects of BEMER after only 22 minutes. So BEMER was already done for 8 minutes, 22 minutes after application. So 30 minutes after starting therapy, the effects of BEMER therapy, while temporary, have been documented to last up to 18 hours for some users. Sometimes more, sometimes less. But the fact is, BEMER is an incredible tool to support your local circulation and keep you performing.
So what are some of the benefits of BEMER? We talked a lot about it increases that vasomotion in the capillaries. We talked about that pumping action, but it also can increase the speed of healing, because if we can get improved circulation to get better nutrients and oxygen and better waste removal, you're going to have, and improving your immune system, you're going to have better healing. Because of that detoxing of that waste removal, you'll also notice that better sleep is a common thing that people will notice. Increased energy levels as well, again, because of the waste removal. Better recovery from everything, exercise, injuries, muscle soreness. That's probably the biggest thing. The two biggest things that we've seen in the last couple of months with people using this is that they can exercise. And, you know, as we get older, we just get sore. I mean, we get sore because we just can't recover as fast. This is going to help with that recovery and speeding it up. I literally can do like a heavy leg workout, and normally it takes me 3 days to recover from that. So I have to like manage when I want to do that with staying active the rest of the week. So I want to run on Saturday. So if I do a leg workout on like Wednesday or Thursday, oh man, I can't run. I mean, it's hard to run for me on Saturday, but I get on this and my recovery is so much better with that. Like, I'm not sore the next day compared to what I would have normally been. And again, it reduces that stress and improves that immune system. So other big thing that we see that people have commonly said is that they just feel like their swelling's down, like their swelling's down on their joints. We can do different spot treatments that'll intensify it in certain areas. And when we do stuff like that, that really makes a big difference in those body parts that are giving us more problems. So what are you going to take from this? Most injuries don't require surgery or medications. Most of the time, your pain comes from somewhere else. MRIs and x-rays don't help us in guiding the treatment and resolving your knee pain. And make sure you find a specialist to help you figure out where the source is coming from. Like, you will just get better results. And honestly, it's really hard to find people like that. That's what we hear it all the time when people come to our office, because they don't spend the time to figure it out. I don't know if they want to spend the time to figure it out. They don't critically think. We see all these things happen. It's when I hear people coming into the office and hearing their experience, it's horrific. And I just want to really give you hope that you can get back to living your life. And, you know, I do say there are times that we do say, yes, surgery is something that is needed, but I mean, I'm telling you, like, it's 1 or 2 times a year. It's not very many times at all. And so what would your life look like if you could solve your knee pain? Like, it's the only way we can stay active: walking, cycling, running, being active, doing anything, yard work, whatever. Like, we have to have our knees in order to be able to function and do things. Here's another story. We're not going to listen to the whole thing, but she had knee pain and she was very fearful that she wasn't going to be able to travel. And that's what she loves to do. And so she decided to come in, and her knee pain wasn't really coming from her knee. It was actually coming from her hip. So here's her story.
Hey guys, this is Stephanie here with Empower Physical Therapy. And today we have Nancy, and I'm so excited for you guys to hear her story, because I know you guys hear me all the time where I say where the side of the pain is may often not be where the source of the problem is. And she has that exact same story with knee pain. So let's get started. Tell us a little bit about like your knee pain, the history of it, what it was stopping you from doing, how long you've had it, all that good stuff.
My knee pain, I've had surgeries on both knees. And my knee pain has gotten worse of late, and the surgeries were, well, one of them was, I don't even want to tell you how many decades ago, but I had one, I know, I had one a few years ago when I tore an ACL, which is what I've decided is the only real reason to get knee surgery is if you do something that drastic.
Oh, absolutely.
And it was to the point, I walked the dog every day, and that was okay. But when I don't have that many stairs coming to my house. I have 3 steps coming from the street, and then I have 3 steps going to the porch, front porch when I walk him. And I was literally kind of lurching my body up the stairs because it was hard for me to climb stairs. I really noticed it a few years ago when I was in Europe, because there's stairs everywhere. And it was really, I mean, there was just one thing, I think it was in Rome. It was a memorial to their only emperor, and it was all stairs. It was like 8 stories worth of stairs. And I went, there's just no way I can do that. You know, there's no way. So I didn't do that. I took pictures from the ground. Luckily, it wasn't a museum or something I really wanted to see, but it holds me back. And I was just tired of it. And Stephanie had Stephanie had worked wonders on my body. How many years ago was that?
Oh my gosh, probably 3 years ago, which is crazy that it's been that long.
Yeah.
It seems like it was just yesterday.
It does. It was more than 3.
It could have been. Yeah, it totally could have been.
It was like 5 or 6, I think.
No, I haven't been open that long.
You weren't open.
I wasn't open in my office, but I think it was probably 4 years ago.
Yeah, it had to be because I had Grover.
Yeah.
My dog. And he loves Stephanie. But yeah, so I went, you know, you're tired of this, you're tired of your knees just hurting. I've been doing yoga, but they still hurt. And I wasn't doing it correctly because I just didn't have any strength in them. And no matter how much I did yoga, it wasn't helping.
Yeah. What were some of your fears if you didn't get this solved?
And it would really, I mean, I'm retired, and what I was totally looking forward to, who knew about the pandemic, but what I was really looking forward to was travel.
Yeah.
And I did. As soon as I retired, I was like all over the place, and it was wonderful. And I was really worried that was going to be, here was my big plan, and I wasn't going to be able to do it.
Yeah. And, you know, a lot of times people think that, oh, I just need to get more strength in it and it's going to be able to help me. But you've got to go and take a step back, because if you can't actually move, like if the knee doesn't move, if the hip doesn't move, if the back doesn't move, if any of these pieces are a part of what's going on, your muscles won't fire. Like you can't get stronger. So you could do all the strengthening exercises you want to do and be like, but I'm not getting any better. And that's why.
Yep. That was happening.
So since coming in, and I know we're not completely done with therapy yet, we are, midway through it. Tell us now, like how you're feeling and what's going on since then.
Well, you really pinpointed my left hip as a part of the problem, and opening it up and doing that. It's like, now I climb stairs like a normal person. I'm not lurching my body forward to have my weight pull me up.
Yeah.
And that's huge. Yeah. And number 2 is, I can see how my body's acting in yoga, and it's like, oh, look, I can cross do a cross-seated, whatever you call that.
Crisscross. Yeah.
Crisscross sit. And I can do it fine. And I don't have to be on a bolster, or I don't have to be on 2 blankets.
Yeah.
And even my yoga teacher commented, he said, you've gotten much more limber. Your hips have got, and he said, it's your hips. Your hips have gotten much more limber, I can tell. So that's what I want to hear. You know,
Yeah.
that's the kind
Well,
of thing.
and a lot of times we end up stretching the wrong way. We think that, oh, I've got to move my body this way so that I can get it to open up. And that's more of like, okay, I'm going to stretch the muscle so that I can actually move it. And it's not usually the case. A lot of times it goes back to, you know, that first phase of physical therapy. You have to improve the mobility of the joints. And often the way we stretch it is opposite of what we think that we need to do. And that opens everything up. And I mean, I remember the first time I was like, whoa, your hip, like, I mean, it just wasn't moving. And it was amazing when we started getting it moving, even on that first visit, the knee dropped, like your knee range of motion improved significantly. Now we've had to address some knee stuff as well because it's all connected, but a huge component, if you went to any other part of your body before, you know, like going to the knee first and not getting to the hip, we wouldn't have the results that we had.
Right.
All right, we'll move on from there. So we have a couple of options. We have a thing what we call kind of a discovery visit, or we can do like kind of a knee pain assessment. And we do this for free for people because we really want to understand kind of what's going on, make sure that we actually can really help you, make sure that you guys are comfortable with us and getting all your questions answered before we move forward. We want to make sure that we can kind of spend the time with you. And so this is really to help you make a better decision about your health. And then if you decide that you want to come in, for an evaluation, and then we'll take $100 off your evaluation if you get something booked in the next 15 days. It doesn't have to be in the next 15 days. You can just book it within the 15 days. So we'll take $100 off for anyone that's showing up live on this event. And so this is our next event. We're going to actually do it with a YMCA, and we're going to talk about how to slow aging with exercise and physical therapy. And there'll be a lot of really good things on like how to get rid of those nagging aches and pains that we think is just a part of aging. Doesn't have to be. Again, a lot of the things that we'll talk about up here, we're going to talk about there, but we'll also get into exercises that are important that we need to get into doing as we get older. That's really a key thing to really help us age a little bit more gracefully. So let me